we're developing a self-service kiosk that automates diagnostic testing. Our kiosk is deployed at the worksite at a private location, like a private office room, and performs real-time on-demand diagnostics inside of itself, generating results in about 15 minutes. Hi everyone, my name is Michael Tu. It's nice to meet you all. I'm the CEO at Everyplace Labs. I'm looking forward to sharing more about our company with you. And then afterwards, my co-founder Claire Zoe will be joining us for Q&A. Employer demand for on-site healthcare has grown significantly, and lab testing is one of its key offerings. In fact, 84% of employer clinics offer lab testing. It's the most common service they offer. In our customer discovery process, we learned from essential employers that they want more and more on-site testing to improve workplace safety and employee health for their essential work sites. And these include manufacturing plants and warehouses and retail locations. And they want more on-site testing because their essential workers need to be at the worksite for significant hours during the day. And if they leave the worksite, it can cause significant disruptions to their workday and their productivity. And the types of tests they want to implement can span from COVID and flu testing to drug testing and chronic disease screening. However, most essential work sites cannot implement on-site testing because of its high costs, required human resource oversight, and complex logistics. Today's solutions include worksite clinics, which is not economical for most work sites to have, especially those with less than 1,000 employees. Another option is self-testing, which requires quite a bit of administrative oversight and creates administrative headaches for human resource staff. And mobile clinics, which are costly and difficult to schedule around shift work at essential work sites. To address these pain points, we're developing a self-service kiosk that automates diagnostic testing. Our kiosk is deployed at the worksite at a private location, like a private office room, and performs real-time on-demand diagnostics inside of itself, generating results in about 15 minutes. For the employer, it represents a cost-effective and a turnkey testing solution that they don't need to actively manage. And for employees, it represents an affordable and reliable testing option that gives them confidence they performed the test correctly. Our initial test is a COVID test, which will enable employers to have the testing capabilities they need. Currently, 65% of low-wage workers go to work when they're sick. Our solution automates testing and the processes that surround on-site testing operations. We have a built-in test kit dispenser that dispenses test kits, a screen and a digital mirror that guides the patient through the sample collection process. Our kiosk automates the testing process, including sample reagent mixing, sample dispensing, and result interpretation. We have built-in sanitation capabilities, including converting medical waste into municipal waste, and the kiosk self-cleans itself between patient usage. From a workflow perspective, it starts off with the patient scanning a QR code, and the kiosk will dispense a self-testing kit that contains a swab and a cartridge. The patient simply collects their sample and inserts it into the cartridge, and then they simply insert the cartridge into the kiosk, and from there they can walk away. And they'll receive results on their phone in about 15 minutes, and they can also opt in to share their results with a telehealth clinician for follow-up care. And real-time testing occurs inside of the kiosk through a robotic analysis engine that automates the manual steps of today's testing process. We designed our system to be very modular, and we're leveraging existing test strips so we can officially expand our test menu to a wide range of tests, including flu testing, drug testing, and chronic disease screening for diabetes, cardiovascular disease, and chronic kidney disease. We're providing turnkey on-site testing services to employers at a low cost of 50 cents per employee per month and $20 per test. And our low-cost solution streamlines on-site testing operations, providing employers with an 81% cost savings compared to outpatient testing, and we're providing the best combination of ease of management and cost effectiveness. We de-risk key commercial technical usability challenges. We developed our beta system, and we're currently piloting it with a large drug delivery company at their manufacturing plant. Their manufacturing workers prefer our testing solution over other options. And we also have an average user experience score of 8.8 out of 10 right now, and secured our first US patent approval. We have a cross-industry team from the medical device, industrial equipment, and consumer goods spaces, and we're advised by leading experts in the diagnostics, healthcare, and employer health spaces. So if you're interested in learning more, feel free to reach out to me. I'm looking forward to connecting with you soon.
Question from Esther Dyson. She'd love to hear more about what you know data-wise about the spread of disease within companies, anonymous, of course, What do you know that might surprise us? How do different groups differ in terms of showing up or staying home when they're sick? I'm sure you've learned a lot of interesting things. Michael or Claire.
Yeah, I can cover that. So we spend a lot of time with employees. Actually, right now I'm at our pilot site, which is a manufacturing plant, hearing stories about how employees that work in a production environment think about taking sick days. So this study that Michael has just pulled up here is a study from the Harvard Shift Project, which found that 65% of workers, hourly low-wage workers, that reported being sick in the last month went to work anyways, and that's because those individuals, often don't have a lot even in emergency funds, and every day that they can work is a day that they want to work if they can do it. So, today we were just speaking to an employee who had symptoms that could have been COVID, but she also has asthma and was not sure what she had, so she came to work anyways. And 3 days later, she got, a PCR test result back that said that she was positive. At that point, she told her supervisor and was sent home, and all of the people that she had worked with in the previous 3 days were informed and had to be COVID tested. So it's very common for employees in this environment, especially when you're working in close quarters, to bring COVID to work, and especially in the types of professions that they are in. So we see that a lot, at least anecdotally, in the conversations that we've had with employees and potential users of our system. And that's also supported by, the data about how employees deal with going to work sick.
That's really interesting, Claire. Also sad to hear about, but not a surprise. You mentioned you're at a pilot or a customer today. One of the questions in the chat is, are you currently deploying this with any large employers? I don't know if there are any reference customers that you can mention, or just kind of speak to the types of organizations you're working with.
Yeah, that's correct. Yeah, so actually the kiosk is just behind me here. You can kind of see it in the blurry background. So yeah, we are deploying it right now. Right now I'm at Nemera, which is that drug delivery company. It's a manufacturing plant that's here in Buffalo Grove, Illinois, in the greater Chicago area, about a 430 employee plant. And so we're doing user testing on site just to get feedback and continue to improve our platform. We've gone through a couple of iterations of our user testing, and actually the scores that Michael showed are aggregate, and we are seeing increasing user experience scores as we continue to improve the platform. We've also performed a study with employees at Nemera previously, where we surveyed employees to see if they'd be interested in using our platform, and about 3/4 of employees that were surveyed were interested. And it was preferred over other testing solutions, which include going off-site for testing, as well as self-testing using, the at-home kits that are available today. We actually found that for this particular employee population, which were primarily blue-collared workers, that when the survey was done, none of them had actually ever done an at-home test, right? So we think of these as being very prevalent tests, but in fact, for certain populations, they're actually not very often used at all. And employees were interested in using our platform over others for a couple of different reasons. The number one being that, it gave them greater confidence that the test was performed correctly, since we automate a lot of the steps in the process that would otherwise be performed manually in an at-home test. It gives them greater confidence that the results are actually correct, and that none of the user errors that they could have made would have produced, a false negative, as an example. And then another site that we are working with to deploy a kiosk this summer for a summer program is actually IMSA, which is a residential high school in the Chicago area.
And
Thanks,
I have
Claire.
a photo of our beta system that we're piloting. And right now, the average user scores, we're getting usually 9 out of 10 or 10 out of 10 when the manufacturing workers rate the user experience.